We're now joined via Zoom by Eastern Cape Department of Social Development Head of the Department, Mzimkhulu Machemba, as well as Andy Du Plessis, the Managing Director of FoodForward South Africa. Very good afternoon to you both on the channel. Andy, let's start with you. I mean, you've just heard that clip from our reporter and Nkonji. When you look at the global, hunger index, although this country has no problem with food shortage, thanks in part to commercial farming, you still have one in every three children who lives in food poverty. And what's even more concerning, is that 45% of the available food supply in this country is wasted. So if the country has enough food, why do we still have millions of people going hungry? And just after that report, some of them even dying.
Yes, Ayonati, thank you very much for having us. This is, this report it's sad to hear, especially for an organization like ours that's involved in addressing short-term hunger. But it's a sad reality that in South Africa, 50% of children born in hospitals die of malnutrition. So 50% of child deaths are attributed, to malnutrition. And 27% of our children, as you quoted, of our children 0 to 5 years old suffer from severe to moderate malnutrition. And this in a country that produces enough food for all its people. We have a net surplus of food in South Africa. We export a huge chunk of our fruits and vegetables going to all the other parts of the world. And then in addition to that, over 10 million tons of food in South Africa is lost or wasted. So we're talking about good edible surplus food that is lost or wasted throughout the supply chain. And the reason why we have a country where millions of people are suffering from malnutrition and starvation and dying, as you've seen in the Eastern Cape there, is because there's a lack of affordability and accessibility to healthy food. So take, for example, onions. Onions have gone up by over 50% in the last year, the cost of a bag of onions. And that's just a plain commodity that people use to make simple stews and those kind of things. So we have a real problem in South Africa in that although we have this huge amount of food, and we're talking about good edible surplus food that's ending up as lost and wasted in the supply chain, we need to make sure that we recover that food before it ends up in landfill. That's the issue here. And, that's the only way to address the problem of hunger. When we talk about 30 million people that are food insecure for 1 or 2 weeks of every single month, according to the NIDSCRAM report of 2021, then buying food is not the option. So we have to look at other solutions. And this food banking model that we implement across FoodForward SA nationally is a key to making sure that we address this problem of hunger and starvation.
And before I speak on the solutions, Andy, perhaps let me bring Mr. Machemba in this conversation. Mr. Machemba, in the past 15 months, just looking at your province, 14 children below the age of 5, in fact, starved to death in Nelson Mandela Bay, and 216 new cases of severe acute malnutrition were confirmed in the province, in your biggest metro. And we heard there from Anda that, about 7 children died in Butterworth alone earlier this year. Also, 16,000 families left without food due to a slow contractor. I mean, is the province experiencing a crisis? Is that why the human, the investigations, in fact, several investigations are currently ongoing?
Let me confirm, good afternoon, Madam and the viewers. Let me confirm your statistics regarding Nelson Mandela. It's not only Nelson Mandela. This problem of malnutrition is across the province. But Nelson Mandela in OR Tambo, followed by Alfred Nzo, are high on the list. Since the beginning of this year, both the Department of Health and the Department of Social Development have put in place a program to track rigorously cases of severe acute malnutrition. The Department of Health has a comprehensive plan to deal with actual malnutrition, to deal with to implement rehabilitation, preventive measures, and corrective measures. The Department of Social Development on its side has got a role and a responsibility to ensure that there's social protection, especially on the vulnerable. And the children here are the most vulnerable. So this program that we've partnered with health, with NDA, and with Dr. Da and other stakeholders, seeks then to follow the hotspots of malnutrition. Though these have been identified through the Department of Health, and what the Department of Social Development does is to follow these families, to profile these families, and to make interventions to make sure that we relieve the situation in the hotspots areas. The Agency of Social Development, the NDA, is coordinating, supported by an international organization, to provide, as my colleague was saying, breakfast packs in the Sarah Baartman area, in the Nelson Mandela and Alfred Nzo area, and we expect, we intend to spread this because we want to nip in the bud this problem of child malnutrition, but it is a fact. In fact, if I can be open with you, ma'am, in the first semester of this financial year, April to September, plus 100 cases have been reported, and of those, about 43 children died. And this is a damning statistics that as a province, we can't afford to continue. Hence, we are upping the game in terms of making sure that, especially in the hotspots and in what we call in the province, the poorest wards, we focus on those in implementing interventions to relieve the effects of extreme poverty.
So, Mr. Machemba, from my view and where I'm sitting, and just after those numbers that you've just told us, in as far as your reports from April to September are concerned, so 100 cases, 43 children have died in the Eastern Cape alone due to malnutrition and starvation. Of course, from where I'm sitting, this spells out a crisis. It's no wonder they say that South Africa is facing the slow violence of malnutrition, but we are not a war zone country. So where are the problems exactly lying? What is the problem? If you can just spell to us from your department's perspective, particularly if you were listening to that previous clip that talked about the 4-month-old baby who is fighting for her life in hospital. What are the interventions that you have done since that child has been taken to hospital? Because we have listened to your colleague, and that is why we invited you this afternoon.
There's a part that will then be a clinical part, ma'am, that is dealt with by the Department of Education, by the Department of Health. Our role becomes that of visiting the family. As I was saying, that we will then go to the family and look at the situation of the family, and we then provide interim measures in terms of our social relief of distress, which basically means we provide food to that particular family. But what we do then is to rope in NDA in terms of the breakfast packs that I was talking about, so that over this period of 10 months, that particular child and the family are taken care of in terms of relieving the severe situation that they find ourselves. And perhaps what we then need to deal with is, as I've said, that we've got all of these interventions and plans that we've put in place, what are these loopholes then that still lead to cases of this nature? Is it a question of families not being aware of what they should do? Is it a question of officials of the Department of Social Development, of the Department of Health? Is it a question of communities and councillors not bringing forward cases? Because we encourage communities, we encourage families to come forward and bring to the attention of the Department of Social Development or a Department of Health, for example, so that immediate intervention can be can be made in cases of this nature.
And I want to talk about those coordinating efforts in a second. But Andy, let me bring you into this. I know that as FoodForward South Africa, you've now launched a petition to end hunger, through the introduction of food donation policy. We know, of course, that probably more needs to be done, but you seem to think that this policy is probably an immediate intervention that is needed now whilst we find long-term solutions. Talk to us about, what necessitates this policy then to take place, and also what it entails.
Yeah, so we firmly believe that a food donations policy is key for South Africa to rebuild our economy and for our people to get the necessary food they need while our economy generates jobs. So we've been working for the past 2 years with the Consumer Goods Council of South Africa, with the Global Food Banking Network, and with the Harvard Law School's Food Law Project to put together a set of recommendations around food donations policies. And what we've realized is, after we've conducted surveys in partnership with the Consumer Goods Council of South Africa, is that companies are telling us that if there was a food donations policy, they would donate more of the surplus food instead of dumping it and incinerating that stock. 71% of respondents say that. And then 54% of respondents say that if there were clear food regulations or food security, food safety regulations, if they were clear, then they would also donate more. So there clearly is, throughout the food value chain, from farmers, wholesalers, retailers, there is appetite for people to donate the surplus food. Now, just to give you a bit of context, Unati, when we talk about surplus food, we are not talking about expired food. We are not talking about food that's substandard. We are talking about food that is good for human consumption, but because of over-ordering, because of oversupply, these goods are not able to be sold because of damaged goods, because of the outer label being damaged. They can't be put on a shop shelf, so they're not good enough to be sold, but the food inside is good enough to be eaten. And we're talking about over 10 million tons of food that's lost or wasted throughout the food supply chain across South Africa, costing our economy 71 billion rand. Now, just to give you an example, in the Eastern Cape, we've already reached out to the Department of Health in the Eastern Cape, and we said, give us your updated statistics of the children that are suffering from malnutrition. We want to make sure that those people get a food parcel, that the family gets a food parcel. 1 year later, we are still waiting on the health department to give us those regions, and we've now reached out to, we've got over 400 organizations we are supporting with food every month in the Eastern Cape. And we said to those organizations, we've now taken the Premier's presentation that he did at the Human Rights Commission of Inquiry in the Eastern Cape, as you mentioned earlier. And we said, we'll take in those areas now, and we are trying to reach out to those communities. But we need partners to work with us. We are able to get to the households where the DSD is maybe not able to get. We are able to reach those households. We did a program with the Department of Health under COVID level 5, and we delivered food parcels door to door to indigent families that were identified by the Department of Health people suffering from malnutrition. We can do this, but a food donations policy is key to making sure that 30 million people in South Africa get the food that they need. We are a country that has enough food, but yet we are wasting that food. So we need to solve that key problem across South Africa.
Absolutely. Andy, we're going to have to wrap up this conversation, but Mr. Machemba, just as we close our conversation, just given what Andy has been saying in terms of solutions, looking at some of the interventions that you have, I'm specifically talking about the nutritional program that the Department of Social Development has currently ongoing, and the number of departments that are involved. In terms of coordination, how best can you tighten these coordinations? Because we heard from, that clip that we heard by Anda Nkonji, who went out there and visited these affected communities. You have this nutritional program, but it ends at 3 months. There are some undocumented, people who have not been able to get those food parcels because they haven't been able to register their children. They are South African. And also, we understand that, some of the children that are in hospitals are over 4 months. So obviously they sit outside of that program. How best can you help South Africans, particularly in your province, with this problem, with all of these different departments working together and tightening, those systems that you currently have in place?
The Department of Social Development has resolved to perhaps take a lead in ensuring what is called the ward-based programs are implemented. And by what we mean by that is where the collective of the various organizations that operate in a particular ward to be coordinated at that level to make sure that information that needs to go from one organization to the next organization is able to do that. Let me just make an example that in Alfred Nzo, they have retained the mechanism we used during COVID of jokes. And if they want to communicate any particular thing, it is done with speed. And we think as social development, we need to revive those in all the other districts as well. Because if people live in wards, and if you are effective at a ward level, then you are most likely to reach the people that need to be reached. Secondly, the Department of Home Affairs has identified, just as we have done when we have gone to the most rural areas, that there is a lot, not only in Nelson Mandela, there are more people that are not documented, even adults without ID document, many children. And the Department of Home Affairs coordinates efforts to go to various areas in order to make sure that we increase the number of people that get children that get birth certificates, adults that get identity documents. We are not where we intend to be, but we think that the effort that has been started by the Department of Home Affairs will get us there. Because remember, this social protection through the SASSA grants is the base that if we get everybody who's supposed to be reached, at least we know that there is likely to be a relief, a reprieve in a particular family. But we admit as social development that we need to work together in this coordination of making sure that people are documented. But I also want to touch on what Andy said, and on behalf of the Department of Social Development, I would like to welcome the gesture by Andy and his organization. It's a pity that they did not get the information that they requested, but now that we've spoken with Andy, we can facilitate, because those areas, those statistics are readily available because the Department of Health has them, and we will only be too happy to assist, because it will then take us nearer to dealing effectively with this particular problem. Thanks, ma'am.
Mr. Du Plessis, thank you so much. Any final comments from you? Just 30 seconds of your response, especially to the department.
Yeah. Absolutely, just two things. I did say to Mr. Machemba that I will connect with him and we will make sure that we support them. Those families that have been identified with malnutrition, we will provide them with food in the coming weeks. We confirm that we will do that. And also please visit foodforwardsa.org and sign the petition, South Africa. It's important that we put pressure on government for a food donations policy, which is going to put us on the road to make sure that by 2030, we halve that food loss and waste, and we make sure that hunger is addressed across South Africa. Thank you.
Mr. Machemba and Mr. Du Plessis, thank you so much for your time this afternoon. Really do appreciate it. Of course, that was the Eastern Cape Department of Social Development, Head of Department, Mr. Mzimkhulu Machemba, as well as FoodForward South Africa's Managing Director, Andy Du Plessis, talking about this very important and concerning crisis that is, of course, brewing in the Eastern Cape there. Mr. Machemba talking to us there about the latest reports revealing that they've had 100 cases of malnutrition from April to September this year, and 43 children out of those 100 cases have unfortunately died from malnutrition and starvation.